Okay, so the first things I'm supposed to start with is your name, your degree, years in practice, location.
Sure. Okay, well, my name is Erin Mackenzie. I'm a nurse, an LPN. I graduated from Mount Wachusett Community College about a year and a half ago. I've been a nurse for almost 15 months, and I work at the Justice Resource Institute in Marlborough, Massachusetts. It's called the Glen Haven Academy.
So what do you do on the job? What kind of work do you do? And who do you deal with? Who's your clientele?
I am a psych nurse, so I work with at-risk youth that are unable to live at home due to various reasons. So a lot of the kids that I work with are DCF involved, from Massachusetts and Rhode Island typically. They range in age from 12 to 22, although our current oldest kid is only 18. And it's a 37-bed program, and we are currently at about 30 kids, but we have several kids home because of the pandemic. So some kids who are working to transition home can be at their house. So that's where they are residing currently. So what I do in a typical day starts at 7 a.m. with the morning med pass. So there's a 2-hour medication administration time period for the kids. They're getting ready for the school day during that time, which starts at 9 a.m. And fortunately for us, the school is also located on the same property. So it's all one big facility, a specialized residential and a therapeutic school setting for the kids. So then at 9 o'clock, I head over to the schoolhouse and support the students during the day if they need middle of the day medications or as needed medications, inhalers, sometimes an EpiPen. Once in a while, I'm called to administer first aid or assist in a restraint. And once in a great while, there's a true medical emergency when we need to send a kid out to the emergency room, either for a psychiatric screening or because they injured themselves or somebody else.
How do you decide what kind of intervention you're going to give? Do you interview? Do you have them fill out forms? Do you get a medical
Yeah,
history?
that's such a great question. So each kid, it's a highly specialized program because each kid comes with their own trauma history and different considerations and how to support them most effectively. So it's a really unique approach for each kid. That's why it's important for all of the staff people to develop a strong rapport. But we also communicate really effectively. So there's a lot of different forms of communication, but each department is sending out updates routinely. And the clinical department especially is what is determining how to intervene. So we always try to use the least restrictive measures necessary. So for example, going into a physical restraint is the last case scenario. We only do that when safety is a concern for the student or for staff or another peer of the student. For example, we have one kid who is struggling a lot emotionally and we have space rooms where there's nothing else except a beanbag located in the space room, so they can kind of take a little space and relax, and the kids can engage in sometimes some property destruction. So we try to redirect them, offer other coping skills, offer a clinical check-in, that sort of thing. I'm always happy to offer ice packs to put on the neck or the wrist to help cool their body down a little bit as a non-pharmacological intervention, but we also have medications on an as-needed basis, such as like clonidine, hydroxyzine. Those things help to assist in lowering blood pressure and creating a calmer mood through the medication route. But we try not to use medication if we don't need to.
So the typical interventions start with something like maybe a timeout in a cool out room and
Yes.
ice packs and things like that, and then go up the ladder to medications and then maybe restraints.
Yes, exactly.
Anything else in between that I missed?
I try to be creative. I come from a history of doing in-home family therapy, so I used to bring a lot of interventions or like kind of therapeutic distractions or redirecting activities. So for example, I have a lot of different artistic things that I offer to kids, or fidget spinners. Sometimes kids just need some physical way to let out some of their anger, or sometimes we offer kids to rip up paper. If they rip it into small shreds, sometimes that kind of gets their physical energy that they need to get out. So if they're safe enough to use things like artistic tools or something, or journaling, I have like empty journals I keep on hand, and like a Rubik's Cube and fidget spinners and that sort of thing too. So anything to get them physically engaged can help them better focus mentally.
So when you give them journaling, it sounds like you might sometimes give homework or things to do when they're not around you.
We can definitely. And also, if the kids, when they're outbursting, create any property damage, they have to do something called restitution, which basically means that they pay for whatever they destroyed through chores. So we have age appropriate chores all around the program. And then if they physically harm, for example, I was punched in the head about 3 weeks ago, I think 3 or 4 weeks ago, and that student was asked to do an apology letter. So they do have some homework afterwards where they're supposed to really be reflective and try to expand on how they can act better in the future.
How's patient compliance with that?
Pretty good, actually. I would be surprised, or I am surprised, I would say, by how consistently they are able to follow through. And I think that is attributed largely to the consistency that the staff offer. Because in my mind, a bunch of teenagers who have trouble regulating themselves anyway, and also can struggle to communicate, might not be wild about completing those tasks, but we do a good job all around of working as a team, making sure that they meet the expectations they need to meet.
So challenging patients, how do you cope with them?
How do I cope?
Well, you were mentioning that you had someone that really shouldn't be there, but you couldn't, because of the virus, send him anywhere.
Yes, absolutely. And this is a really important consideration right now. There's so many things really across the world right now that have to be adjusted in ways that never have before to accommodate the considerations of the virus. And behavioral health is certainly one of them. Right now, we're pretty reluctant to send kids out to the hospital for psychiatric evaluation, because we're worried that in the ER, while they're waiting for the psych bed placement, that they could contract the coronavirus. We also are not allowed to accept those kids back right now per our program director after they've been in the community, because they're assumed to be exposed. So we have to go through this whole quarantining process, which kind of leaves us in a place where there's kids who might struggle with safety sometimes, and we have to look at weighing the risks and benefits. We typically, even before the pandemic, wouldn't send a kid to the ER if we didn't need to. It's a clinical evaluation, and there's also a team that comes out, usually it's psychiatric emergency services, that assesses whether a kid needs to meet the hospital level of care. But right now we have to really try to be as creative as we can to work on solutions in-house, and really use the ER as an absolute last resort.
Was the one that hit you in the face the one that was a little bit of a challenge?
Yeah, certainly. It's an interesting job, because I love the work, and this student happens to be on my nursing caseload. The kids are all split up between several nurses, and I like the student a lot and have a great rapport with them, and they were able to make a repair after the punch in the head before they were sent to the hospital, but they continue to aggress against staff. Unfortunately, we have multiple staff with bite marks right now, and other various bruises and injuries that they're recovering from. So that was due to having to restrain him multiple times. And so it was determined, after these repeated assaults, that we were not able to keep him safe at our program. So.
And what kind of record keeping do you have to do, especially with cases like that?
Yeah, so documentation is so key. It's how the rest of the team, all of the staff, and all of the different departments at the program have to be kept aware of all the up-to-date news on each student. So in addition to sending routine emails and collaborating in person and over the phone all day with people on campus, we also use an electronic health record called the HANA, where we record any injury that a student comes to nursing with. Sometimes kids will slip and fall playing football, or in the gym class, things like that. So we have to apply minor first aid. And then we also make sure to update the guardians for the kids who are living with us, so that the folks back home or DCF are aware of what's going on with them too. So a lot of transparent, just an abundance of communication is a pretty ideal way to make sure everyone's on the same page.
Now, do you co-manage a lot of patients with other
Yeah,
practitioners? Or
we
just,
do. So we currently have 4 nurses that share the caseload of approximately 37 kids, but they are not all split up evenly. One of those nurses is only on campus a few days a week. So typically, like currently, I have 10 kids on my caseload, which is a pretty manageable amount. Depending on the staffing in the nursing department, sometimes we have to accommodate higher caseloads, but having a lower caseload is more ideal because we get to spend more time working with each case and providing as much attention as we can.
now, recently you went and worked with COVID patients in a nursing home.
Yes.
You want to tell me about how your first day went?
Yeah. um, I mean, it's an experience I'll remember, I think, for the rest of my life. I ended up catching coronavirus from a silent carrier who was not showing any symptoms in late March. So I quarantined at home and got over that myself and now have relative immunity. So I wanted to put that to good use, especially because there's not really enough nurses available. So I found a local COVID positive floor and applied to start working there. And I was amazed how quickly they were able to really fast track that application process. I accepted the job on Thursday afternoon, and I think I was training Monday morning. So it was very quick. I was working at a location in Newton, and as I walked into my very first shift, there was a morgue service there wheeling out a recently deceased patient of coronavirus through the front doors. The patient was wrapped in their own homemade quilt, and they were going by me out the door as I was walking in and trying to find the administrator. And I kind of took it as a bit of an omen, which it ended up being.
Yeah, that sounds tough. And I do know people oftentimes will make quilts, donate them to nursing homes. So I
Yeah,
something like that.
true. Yeah.
When you were there, what kind of things were you doing?
So it was a facility that had several floors. There's like a long-term psych floor. There's a rehab floor. The floor that I was on was a rehab floor that had been remodeled just 2 weeks prior to accommodate COVID patients exclusively. So all of the patients that I was serving on my floor, excuse me, were confirmed coronavirus positive, or COVID-19 positive, I should say, but also had whatever situations they were dealing with medically that landed them in rehab in the first place. So they were older, typically already immunocompromised. They had been exposed to COVID in the hospital or wherever they had been treated previously, and then came to us. Unfortunately, while we were working there, and this really ties into an issue of PPE not being available, there was a patient that was C. diff positive, and within a week's time, all of the patients on that floor became C. diff positive as well. So on top of the coronavirus, C. diff is a terrible thing to have to overcome. And in addition to whatever other comorbidities they already had, these folks had a lot to contend with, these patients. So I will say the healthcare workers are great. I have a lot of respect for them. I think it's wonderful that so many people are willing to step up and fill these roles. We had a lot of people. I'm still new to the environment, so I'm still learning about working in the skilled nursing facility in general, and also learning about all of these coronavirus stipulations that change the environment as well at the same time. So for me, it's a bit of an initiation by fire anyway, but I'm up for the challenge. I like a good challenge, and I'm learning a lot. A lot of the other people that come in or that I've interacted with have a lot of experience nursing, which is great, or being a CNA, because I can benefit from that. But because there's so many staff out already sick, that we are experiencing a lot of people who aren't familiar with the floor. So there was a lot of turnover. Each shift, it seemed like there were new staff there that hadn't been there before, and they were asking me questions about things I'd only learned about a few minutes ago, at the beginning of the shift myself. So in that instance as well, I was able to take some experience from my full-time job in just work to try to communicate, really over-communicate if possible, to try to make sure that enough information was flowing to keep everyone on the same page.
That sounds really challenging. all those different things in place, from having very sick patients to not having the training, and to have people's turnover high. And
Yes. I mean, like I said, yeah, I'll never forget this time, to be sure, but it feels really wonderful to be a part of trying to help when there's so much need.
now, what caused the C. diff to spread?
So, due to the pandemic, there's already, as most people I think are aware, a national or even international shortage of PPE, protective personal equipment, for people to wear. When I was in nursing school, we were taught very carefully about the different levels of precautions, droplet precautions, airborne precautions, contact precautions, depending on what type of disease or uh, bacteria or virus is spreading. So different germs are spread in different ways. And so different levels of PPE are needed. And for a C. diff patient, C. diff, of course, being short for Clostridium difficile, if it's for that kind of disease, unfortunately, is highly contagious. So we do a full protection. So in addition to gloves, which is part of universal precautions, we also wear a gown, hair net, and I've always been taught to wear shoe coverings as well when I was learning in my clinical settings in the hospital while in nursing school. And all of that equipment has to be disrobed carefully. There's donning and doffing procedures that the CDC has put forward to minimize the spread of those germs, and then discarded at a waste bin designated for that specific room. Also, in my experience, we've had designated vital sign equipment, like a designated blood pressure cuff and designated stethoscope and that sort of thing, thermometer, in the room that doesn't leave the room for that patient. Again, that's just to localize where all of the contact is happening, to try to keep the germs located in one area. Unfortunately, due to the lack of PPE, I think that really played into not being able to contain all of the germs in one area. There isn't enough to go around. We already had to share, we had to save our PPE from one shift to the next in these little cubbies in a room down the hall from the floor where I was working. And so there's a cubbies full of many different staff people's contaminated PPE that is saved for an unknown amount of time. I ended up working at this facility over the course of about 10 days, and I only had one set of PPE for that whole time.
I don't even know how you could put it on after it's been used and maintained any kind of.
You're correct. It's like a lot of different protocols that are happening right now. I think people feel better having a protocol in place, but microbiologically speaking, it was not a logical process, because there, you could assume that there was some contamination. Again, I felt more confident volunteering to be a nurse that would work on the COVID floor because I already have a relative immunity. But for a lot of these nurses, they go home to children and families, and they really have a lot to contend with, being constantly exposed and hoping they don't catch it. And not having enough PPE puts them at direct risk.
Now, you stayed at a hotel, so what was your process when you were done with work?
Yes, so I had a whole system in place. I was fortunate enough to be, I'm a registered member of the Emergency Nurses Association of America. They recognize LPNs, whereas the ANA, the American Nurses Association, unfortunately does not currently recognize LPNs. So through the ENA, I was able to access the Hilton free hotel room for first responders program, and I have been staying at a Hilton in Waltham, which is not too far from where my job site is in Newton, the COVID positive site. So so there's about 20 other nurses there right now and nobody else. The front desk staff have been really amazing and accommodating and very kind. I just appreciated so much about this experience and people's generosity and appreciation. So I assume it's safe to assume that everything is contaminated. So I try to take extra precautions once something has been cleaned and sterilized. So I walk through the lobby after work, and I put shoe covers on after I leave work before I get into my car, and then wear those up to my hotel room, and then discard those. Those are shoe covers that I personally purchased, actually, because they aren't even made available at work, but I wanted to take an additional initiative in trying to prevent the spread of any germs. So then as soon as I step into my hotel room, to the left is a towel on the floor, and that's where I disrobe all of my scrubs, shoes, and then I try not to bring anything I don't need with me. My keys stay in my pocket of my sweatshirt that's zippered up that doesn't go on the floor, and I still sanitize that and have to wash that sweatshirt separately. And then my cell phone stays inside a plastic baggie all day on shift, so it never comes out of the baggie so it is never out in the air or on any surfaces in the COVID positive floor. I still sanitize that as well afterwards. So you have to be careful, like when I'm handling that baggie, it's a larger one. Um, I assume that my hands are contaminated once they touch the outside of the baggie. I open the baggie, let the phone slide out, wash my hands, then sanitize the phone just to make sure there's no counter contamination. And then as soon as I'm disrobed, I hop right into the shower and take a really long hot shower, scrub and everything, really try to exfoliate, make sure there's no place that COVID germs can land. There's also a kind of a lotion that you can put on, like a skin protectant barrier that you can put on your skin before you go in, that nurses are raving about right online right now. You can get it on Amazon. It comes in a purple bottle, and it's supposed to prevent germs from being able to stick to your neck is often unprotected, I'm finding, even with all of the masks. So, and like around your ears a little bit. So that's a good little tip.
Yeah, I'd love to get the name of that. I know I've always used something on my hands. It's like a silicone coating when you're washing them a lot, and
Yeah.
it takes a little bit to get it off.
Yes. Yeah. That's a good point too. When you're washing so frequently as you're supposed to do right now, as the CDC recommends, you can actually create dryness in your hands that create cracks, which would allow germs to get in. So it's important to make sure they're moisturizing your hands as well, so they don't get dried out and allow germs to get in.
Yeah,
And
it's
then,
crazy the number of times washing and the hand sanitizer and the gloves. So using that, and also I've been putting in a little vitamin E oil into the hand sanitizer, which helps.
that's a great tip. That is very good. I will say in the PPE set that I was told to save and recycle is it looks like that spaceship look kind of. So it's a white hooded number. It's plastic basically, and I feel like I lose 10 pounds in body weight sweating on that shift. Yeah, because you're running around and you have double gloves going on. So especially once the C. diff broke out, your first gloves were considered your skin, and your second gloves you don and doff as you're entering and exiting each room too. So yeah, there's a lot of dehydration concerns, I feel like.
Well, how long is the shift?
Another great question. It's supposed to be 3 to 11:30. I was finding that the overnights, the shifts I worked at least for second shifts, were not coming in until after midnight, and I wasn't leaving until usually after 1 a.m. or later. Typically, though, in the circumstances I'm thinking of specifically, the overnight person was coming off of a 3 to 11 shift on another floor and then coming over to us and was held up because things were, so crazy over there. So I was observing that the supervisor on the weekends, because I mostly worked on the weekend shifts, would stay from before 7 a.m. until after midnight on the weekends. I used to joke that he worked, he seemed to live there because he was there all the time. It was always a crisis to get that next shift filled, and they were asking me to come in as much as I could.
Now, how do you handle, just staying hydrated and eating and going to the bathroom and all those things when you have all this stuff on and it's not easy to
It's
take off and on?
right, it is not. And the expectation as well was when leaving the COVID floor, that I would doff the white spacesuit, so to speak, and put a simple gown on. But a gown doesn't protect at least a lot of you exposed. They were presuming that the areas in the rest of the building were not COVID positive, so that you only had to wear a gown for protection. But again, it seems like you should probably be on the safe side. But yeah, the opportunity to don and doff, especially if you're trying to use the bathroom, is not compliant with the CDC recommendations to prevent the transfer of germs, to be sure.
Was it difficult just to stay hydrated and to, eat.
Yeah. So I would bring a lot of different, like, a lot of water and different beverages to drink. And then when I found what I was eating, which usually it was like 9 or 10 at night on second shift before you had even a chance to sit down because it's insanely busy. You every time you think that you're having a chance to sit and chart for a minute, a patient is dying. Like their vital signs are almost impossible to register because their circulation is slowing. I was observing, modeling on skin and all kinds of signs and symptoms as people were either uh, rushed to the emergency room because they were so um, close to death, or some people actually passed away before we were able to get them to the emergency room as well. So trying to find a little moment to sit down for a second and do your charting and eat was tricky. And I found myself only eating things in packages that I could open the package and peel away and try to hold, so I wasn't interacting with the food at all, which is limited and usually not really a wide variety of food. So I was having like cheese sticks and like the mozzarella sticks you can unwrap, and kind bars, and like just as much water as I could possibly consume. Um, yeah, it was not. One day I was learning a lot from a travel nurse, and I bought her dinner because she was teaching me so much, and we were talking, and she wanted to order pizza, and I just scrubbed so much before I was even willing to think about trying to touch food that I was going to put in my mouth. It was like a psychological endeavor to feel comfortable, but
Now, were you able to look at patients and say, this patient's getting increasingly bad, and we need to do more or whatever, or did they just quickly turn?
So another great question. I was observing both. So in one instance, there was a really sweet elderly lady who was struggling a lot the first weekend that I worked, and I wasn't there for a few days because I was at my regular job, and I thought that she would have surely passed in that time because her vital signs had already been off for a long time. She was really not retaining anything, um, any food she wasn't really able to keep down, so she was not consuming much per oral. So I thought for sure she'd be gone, and when I came back, she was still hanging on by a thread. We weren't able to wake her up. She wasn't really conscious or able to become conscious or aware of what was going on around her, and her vitals looked pretty bad. I was observing the modeling of the skin on her legs, which is when the circulation is not flowing properly, and so blood is starting to pool. It's like an interesting kind of pattern. Is the best way I can describe it. But it's one of the many signs. Usually you see the pulse go high and the blood pressure drop really low. I kept trying to get a blood pressure on her, tried both her upper and lower arms and her thighs with the blood pressure cuff. She was probably like 80 pounds soaking wet. She was very petite. But she, appeared to be suffering. She was having an IV, and the nurses and CNAs are so stressed and don't have enough time to spend with each patient. So so they kind of like rush in, administer the medication, and have to move on to the next patient quickly. So I found a moment when everyone else had left the room and just held her hand through my double gloved hand myself. And because she wasn't able to have family there, I thought I would try to offer her some comfort, and I just kind of like was stroking her hair and told her it was okay to let go if she wanted to let go. I work with a hospice nurse at my regular job, and she was talking about how sometimes that's just what they need to hear. In nursing school, we learned hearing is the last sense to leave your body when you're passing away, and she ended up dying before the end of the shift. She just kind of went peacefully. And that was how that ended. Another patient, though, he was suddenly going down. That was right after I got into shift that day with the travel nurse I learned a lot from. She's been a nurse longer than I've been alive. I'm 30, so she had a lot of great wisdom. And we were rounding on the patients, and nobody had been aware that he was in distress until we walked into the room, rounding at the beginning of our shift. And it was quite urgent. The nurse kept wanting to get a full set of vitals, and I wasn't able to get blood pressure on him either. So we called 911 and were able to have him sent out. But he was he had been talking and interacting. He was very patient. He was just a very kind, like low key, laid back guy, and he just crashed so quickly. And about an hour after the ambulance took him, we were just on the road from Newton Wellesley to the ER. There, we got a call because the nurse in the emergency room was trying to get the updated information for his um, guardian because he was likely going to pass away. So they were trying to alert his family. So yeah, quickly, slowly, with a lot of drama or just quietly, they were slipping away by incredible numbers. On the wall inside a different part of the facility was a nice, like a memorial wall, and there was at least 25 patients that had passed away at this one facility from coronavirus that were specifically dedicated on this wall. So, you know,
It
that's,
sounds like a war zone.
it felt that way. I don't mean to take away from people who serve in our military because I have so much respect for them, and I don't think it was as tough as that in a lot of aspects, but to me it felt like we have to suit up. We don't know how intense of a situation we're fighting, but we assume that it's, you know, pretty life-threatening, the situation that we're going into, or potentially life-threatening. And there's a sense of camaraderie with the other healthcare professionals you're working with, and such an intense set of extremes. Like no one can come in, and you're really separated from everybody else. People are fearful to come near you or don't want to really be involved. They appreciate you from a distance, but they don't want to get too close. So it feels like you're in a war zone, and people are dying all of the time. So
I imagine a lot of healthcare workers are going to have PTSD. uh, Dealing with it, it just sounds mind blowing.
I think that's probably been the biggest challenge for me, and figuring out how to balance self-care as a result has been a big challenge. It's something I'm still learning how to try to improve on. I feel guilty if I don't pick up shifts, and they are screaming for staff. They're always asking if anyone is available to come in more often. So I try to kind of give as much of my time outside of my regular job as I can. And then I find myself so incredibly drained, like emotionally exhausted. I mean, one night after work, I came home and or back to my hotel room, I should say, and I couldn't even cry. I just like laid down. I was too tired to sleep, and it impacts you. Obviously, it's hard to fall asleep after seeing like a lot of death, and then if you do sleep, it can be pretty fitful. Or I've had some nightmares. I think that the healthcare workers should hopefully prioritize their mental health, which is just as much a part of your overall health as your physical health is. People try to segment it or feel more comfortable approaching them as two separate entities, but I don't find that to really be a successful endeavor. And everything's connected.
Oh,
So
yeah. Now, do you wear a N95 mask?
yes, so you have a triple system when you're on the COVID floor. So you wear the N95 mask, then you wear kind of those more commonly seen blue, like paper-like masks over that. And then you have this really terribly uncomfortable hot face shield that comes down and protects your face, which is really hard because that gets fogged up a lot. Or when you're disinfecting it, it gets like cloudy. So that's the
Can you breathe easily through all that?
no, you can't. And you certainly can't. Every time I would go to take a drink out of the water bottles, which I only use disposable water bottles that I threw away because I assumed that they were contaminated as well. You don't even to like pull down your mask for a second to catch a breath or to try to take a sip. Everything that you're touching, you're worried about that coronavirus. So it's just getting on everything.
Yeah, I have a couple patients now who have real trouble wearing them, two of them because they have COPD and
Mm,
have trouble breathing to begin with. So they
yeah.
wear them with their nose exposed, which in theory is keeping other people safe, but not themselves. Um,
Right.
uh,
Right.
and I have somebody who has anxiety who um,
Mm.
panic attacks. She, gets kind of claustrophobic or something with it.
Yeah. Well, I mean, these are such important things. There's healthcare workers that have asthma who can't, like, this could trigger that. And people who wear, unfortunately, leaving your nose exposed is almost the same thing as leaving your mouth exposed. All of these mucous membranes can invite germs to enter that way. So she could be breathing in, um, if somebody coughs, like the patients were coughing or sneezing all the time, it's easy to send those droplets in the air and then suddenly it's up your nose and you're contaminated with it. So
Now, are the N95s, you see the pictures of people with the marks on their face. Are they
mhm.
reusable?
Yeah, the nose thing is real. That's like not fun. In talking to the other nurses, everyone's like struggling with more acne. They're getting like injuries on their nose. Everyone's got little tips about how to like um, protect your ears, because your ears take a beating too with the masks always pulling on them. So they have little ear savers and like tricks of how you can put bandages and gauze around your nose. But and or even if you like figure out how to get all of these different accommodations to keep all your PPE on, you have to take it on and off if you're like if just to take a minute to breathe or eat. So and there's so much time spent hand washing and trying to sanitize, and I took that very seriously, especially when there was a C. diff patient. Unfortunately, he did not have his own designated set of vital sign equipment, so we had to use the same single set for the entire floor, which I think played into why the C. diff spread across the whole floor. But when I was working on my shifts, even though it took more time, and some people were suggesting that I not spend as much time sanitizing, it was really important to me to try to maintain that sanitization process between each patient. This is the gold standard of care.
Now, what are ear savers?
Oh yeah, there's like these I don't have a mask with me, but the loops of the ears of the masks go around your ears, and this part right at the top of your ear can kind of get really raw, and eventually after so many shifts it can get pretty injured and you can't even rest your mask there. So it kind of holds the ear loops of the mask behind your head so that the pressure isn't on your ear itself. It's just along the back of your scalp over your hair. So like different the you can like essentially use like paper clips or tie a string in between the two loops as a to kind of jerry rig it, but they have like these little connecting plastic pieces that are available too.
Now, do you have any clinical pearls you put this year?
um, hmm. We tested all of the students last week at my regular job, the residential program, and we've taken some precautions at that program. All of the staff have to wear a mask or some kind of face covering, and all of the students have come back negative, which is amazing. I thought that we would have had some more silent carriers. I It's a possibility that when I caught coronavirus back in March, that it was due to being exposed to someone at work. So I was already isolating at that time or self quarantining outside of work. So I thought that another staff person there may have given it to me. It's unclear. I know that it was a person without symptoms because I was never exposed to a known um, carrier. But my exposure was in the middle of March, and we still didn't know a lot at that time.
Well, we still don't have enough testing, but yeah, it was even worse back then. It's amazing
Yeah.
you actually got tested. I bet if you weren't a nurse, it might have been a lot harder.
So my only symptom when I first like had a suspicion that I was ill was that I had lost my sense of taste and smell. Like I said, I'm 30, I'm pretty young and otherwise healthy. So I didn't have any fever, malaise, coughing, just any other symptom at all. So I was assumed to be positive, and my PCP suggested that I stay home and quarantine without using up one of the tests because they were so rare at that time. But then after several days, I developed some shortness of breath and was concerned about that getting worse or maybe suddenly worsening. So I did go to urgent care where I was seen, and they did decide to test me, and it came back positive. So then I was required to have a negative test performed before I went back to work. But yeah, I also felt bad using up two tests because there's so many people that, needed to be tested as well.
So in the beginning, you didn't feel that bad, but then a week or so later, you felt worse.
that's when the shortness of breath kicked in, and um, at that point, I was quarantining my room. I didn't want to spread a lot of germs around, so I was spending a lot of time sleeping. I It's been interesting to hear about the psychological effects that people are feeling, the side effects. Um, I'd say that maybe there were a lot of different factors. I was physically less active. I wasn't outside. The weather was terrible in March and early April, and I wasn't connecting with other people because obviously I was isolating. But between all of these different factors and perhaps the coronavirus itself, I it was kind of a down period of time. Yeah, at first I thought maybe it'll just be a nice break, but it was a little depressing, to be sure. I've never struggled with depression in my life otherwise, but it was a kind of a bleak period. And once I finally came out of quarantine, it was really important to me to get moving and try to connect and do other things that are good self-care for me. Try to be outside if I can. That always helps me to feel better. So now that the weather's lovely and I'm lucky enough to be a person that gets to go to work right now as an essential employee, that has really gotten me feeling good again, back on track.
Well, I did read something where they said if you lost your sense of smell, they didn't know if it was just the olfactory nerve being affected or if your central nervous system was being affected a little bit, and that may be causing some of this emotional stuff. But
Yeah.
people that haven't had the virus, I find are really struggling these days. It just is kind of a surreal time, it seems.
Even with so there definitely there's this possibility the virus can actually attack your nervous system, which is interesting, and I've reflected on that a little bit myself. But aside from that, the situation that the virus has created globally, in terms of social interaction, is so, like, the impact is real, and there's a lot of stigma around mental health and people that struggle with mental health. But I think it's important to not pretend that you're impervious to that, because we're all impacted by it. And I think the more people talk about it honestly, which is how I feel about all mental health, just kind of approaching things openly and not judging yourself and trying not to have judgment for other people, trying to be realistic. That's like a place you need to come from when you're going to handle any problem realistically, logically, is to kind of be real about what's going on and look at how you can really make a change.
Well, I'm so glad you're on the job. I think
Thank you.
to have you there advocating
You're so sweet.
and holding their hands and all the wonderful things you do.
I wish I could do more. It feels inadequate at times. There's such a need. It's like a Herculean task to try to figure out how to meet so many people's extreme needs, but finding these amazing other healthcare workers and feeling a part of a community has been really helpful. And there's been so many. This all happened to happen during Nurses Week as well, and there's so much appreciation, especially this year, for nurses and healthcare providers. So it's just been. I feel really fortunate that people have been so kind.
I think sometimes the little things you do, you can underestimate yourself, but matter a lot. And I always think about a patient of mine who had lung cancer and he died. And before he died, I said to him, I am so sorry I couldn't do more. And he said, just coming in here and having you listen and having you support me made a world of difference. So
Mm.
I
Wow.
think holding her hand and stroking her hair, that
Yeah.
made a world of difference.
I
Hey,
wish I could
before we
do.
both had to have a cry.
I know. Thank you so much.
Thank
Yeah.
you, Erin.
Yeah.
I
Well,
figure out how to stop this.
thank you for the interview.
Thanks for giving your time.
Absolutely.